Ask.
Okay.
So, hello everybody. Today we have Rahul Verma from Nano Health Assurance. So, let's welcome him. Can we start by your introduction and a bit about your background?
Sure. Thanks, Ritika. It's a pleasure, and thanks for this opportunity to share some nuggets of knowledge and impact that we at Assurance by Nano Health are trying to deliver in the market and for people. So I'm Dr. Rahul Verma, a medical doctor by education, but was always intrigued more by technology. So I did my master's from IIT Bombay, specializing in cancer diagnostics. Was in the intellectual property, R&D, and innovation consulting space for more than 15 years. Then moved to a company called Clarivate, where we were providing scientific information to all the researchers across the globe, and then was working as CEO of one of the world's largest pharma market research company before I joined Nano Health as a co-founder. So throughout this journey, what has been my experience is that was always very closely related to innovation. Working with Fortune 50, Fortune 100 companies, drawing out their roadmap for the next 10 years, 20 years product launches. Dealt with big data when I was working with Clarivate. Then also, while working in the pharma market research in the healthcare area, found the gaps that are there and how using data we can try to come up with innovative solutions. So that's why I joined Nano Health, where using technology, using data-driven, proactive, coordinated, and continuous approach, we are trying to prevent avoidable hospitalization. So our vision is to see that we are able to keep people out of the hospital, keep them healthier, and that's my passion. So yeah.
What inspired in creation of Nano Health?
Great question, Ritika. So, Nano Health, the inspiration, to create Nano Health was to see nano means right sizing. So people, take it to nanotechnology. So if you look at the complete healthcare value chain, and if the audience can appreciate who's listening in, is that there are so many different stakeholders, from pharmaceutical companies to doctors, to hospitals, to clinics, to a laboratory, to inside the hospital care, outside the hospital care, to pharmacies. Everything is just so disjoint, right? So how all of these key stakeholders, whether they are doctors, whether that's diagnostics, whether that's devices, whether that's pharmacy, if all of these can come together and create a platform which helps in delivering more efficient and effective healthcare, right? That was the motive of setting up Nano Health. And for me, joining Nano Health, the key driver was to see that how using technology and data, we can actually save, lives. So we have now, everyone uses AI, everyone uses data and technology for so many things in your day-to-day life, right? But how can we use in a meaningful manner in healthcare to improve outcomes, to improve the health of people, and prevent them from going to a hospital?
So, from how old is Nano Health and how has it evolved since then?
Great. So, Ritika, we just a couple of months back celebrated a decade of existence.
Mhm.
So we were formed in 2014. Very interesting. I'll share with everyone that actually we got a prize which was handed over to us by Bill Clinton, from the Hult Business School,
Okay.
for being able to right size healthcare, right? So that was an idea. So
Mhm.
since the last 10 years, we have invested in building the technology. We have saved more than, just as an example, in COVID, we saved more than 5,000 lives. We have impacted more than 2 million lives. So it has been a journey for us. And, where we are right now, We are trying to see how we disrupt this space by bringing in, let's say, not only data-driven, proactive, coordinated, and continuous healthcare to the people, but also then bring in health insurance as well. Also try to see that how we are able to make healthcare more democratic and accessible to all. So that's it's been a journey, and where we are just a cusp of really you can say an inflection point to take off and really bring impact at scale.
Okay. So, could you please elaborate on the AI-driven healthcare solution offered by your organization and how they enhance the patient care?
So very, very good question. That's the core of what we do, Ritika, at Nano Health. So using AI, using medically established protocols, we have been able to use technology to tell us what needs to be done next, right? So everyone is collecting data, whether you collect data from lab, from the doctor, from the prescription, from the hospital, or from the pharmacy. But what do you do with that data? Right, that is the key question, right? So data is only as good as what you do with it, right? So we've been able to build the technology where once we enter the data, then the system prompts on what needs to be done next, who should do it, when it should be done, right? And why it should be done, where it should be done, and by whom. So that is the AI, that is helping us. Like I mentioned earlier, we want to create this whole healthcare disjoint, fragmented healthcare ecosystem to be more effective and efficient. So that's where AI and technology is helping us bring all these different silos and data points together to be able to guide the patient on what needs to be done next, whether that's a diagnostic test, whether that's a doctor consultation, whether that's a specialist consultation, or whether that's disease management, right? And who should do it, at what frequency it should be done, where it should be done. And through that, like I mentioned, we have seen more than 35% of the people who were at risk, who needed healthcare services, improving, right? And really all their risk factors reducing significantly. So that's the impact.
So, how is this beneficial for the corporates?
Great. So see, in today's lifestyle, we see that, corporates have started, especially post-COVID, started focusing more and more on employee health and well-being, right? So not only from an objective to see that they have more engaged employees, more healthier employees, but also from a financial perspective to see that there are, less health insurance claims. Sick leaves are reduced and productivity increases. So for a corporate, it becomes a cornerstone to see that employee well-being is the topmost priority. I'll not mention some of the recent, happenings which have happened, news that have come up in terms of young people losing their lives either because of stress or because of, other reasons. All these are preventable, right? And, if you are able to take an approach which is proactive, which is data-driven, which is coordinated, which is personalized, and very, very important, which is convenient to the employees, then you are able to start seeing that employees' health starts improving. And the solution that we have is not only for the employees, but it's also for their family members, right? So many a times, employees take leave because their family members are sick. So we do not only focus on the employees for corporates, we also see that they are able to use our platform and utilize our convenient data-driven services for even their family members if required. And through all of this, we have data where we have been able to improve, sick leaves or reduce sick leaves by 10 to 12%. We have been able to increase productivity by, 17 to 18%. We have been able to reduce health insurance claims by 14 to 15%. And of course, overall, it's not only these numbers, it's the engagement with the employees that the corporate is able to, improve. in a more meaningful manner and very objectively showcase what the ROI is of all the wellness initiatives. So that is what we enable for corporates.
So, how many clients are you associated with currently, or how many corporates are associated with Nano Health as of now?
Right. So right now we have around 50 plus corporates, around 2 lakh lives we cover. Right. So that's the stage where we are. And if we include the family members and everyone, of course, the number goes higher. But our intent is to see that how meaningfully we continue to grow this. We transform the corporate wellness landscape and what it means. There are a lot of companies out there which are trying to do this, but the advantage we have is that we have a robust technology platform. We are using the AI in the right way. And the processes that we have been able to set, the track record we have been able to set, are there to showcase for itself.
So how does Nano Health Assurance disease management approach differ from the traditional healthcare model?
Yeah. So see, how does Assurance by Nano Health Health's approach differ from others, Ritika, is that we are able to ensure that using AI, using technology in an efficient manner, what needs to happen happens actually. If there's a lab test that is due, right? If there is a follow-up doctor consultation that is due, if there's a specialist consultation that is due, if there's a drug or a pharmacy order that needs to be fulfilled, if there's a dietitian that needs to consult, if there's a lifestyle coach that needs to consult, if there's a fitness coach that needs to consult, all of these are available on the same platform for the person or the patient, which nowhere in the world is done in a meaningful manner. So, we are able to ensure that if, let's say, there's a diabetic person, the diabetic person not only needs, of course, to control the sugars through the medicine, but then also needs to see it through lifestyle modification, if through the right exercise, if through the diet, right? They are able to manage their disease, reverse their disease, and in many cases also prevent their disease from happening. So that is the difference, that we bring all these different elements all together on the same platform, stitched in an effective and efficient manner, making it convenient for the patient to see that compliance is there, and then because of that, improved outcomes.
Fantastic. So what are the challenges have you faced during the integration of this technology, and how did you overcome those?
Yeah, so Ritika, healthcare is such a complex system. One, and second, the stakeholders like doctors, they are the most difficult customers, right? So most of our challenges, I think, have been around trying to see that how we simplify in a meaningful manner this complex value chain of healthcare. And second, that how do we actually create a system where doctors are able to configure as per their own processes or their own preferences. So it has taken us 10 years to see that yes, we are able to deliver what I'm just saying, right? But now we see that doctors really are able to configure the system as per their priority, as per their preferences. We have been able to get into the nuts and bolts of the healthcare value chain and the nitty-gritties of it, and being able to link all of those together on the same platform. And it's not been easy, so that's why this much time has gone into it. Also, Ritika, very important is that the mindset of people towards wellness is still evolving. If I am able to walk, means I will not take advice, right? Until unless I'm highly motivated or I'm nudged. So what we have seen is that if you're able to nudge the right people, and then through a convenient, trustworthy, and cost-effective, efficient manner, able to provide them a solution that helps them improve their health, then we are able to see that more than 80 to 90% adoption happens. And that's where we are able to then showcase those numbers in terms of improving health outcomes, in terms of reducing, insurance claims or risk.
So how do you or where do you see nano health in next couple of years?
So see, the grandest vision, Ritika, is that we are able to, through the same platform, be able to provide wellness, be able to provide health insurance, be able to provide health services, and integrate all of these at scale. So I introduced the word wellness as a service a couple of weeks back, which essentially means that anything related to wellness, your health, whether that's your financial support, whether you need a health insurance, or even if you need a health loan, right, we are able to provide, or anything related to your, wellness needs in terms of doctor consultation, specialist consultation, lifestyle, yoga, your diet, your pharmacy, your fitness, right, devices, all of those we are able to provide through our platform. And that's where we want to be a healthcare company driven by technology, ensuring that we are able to ensure and deliver better health outcomes for everyone, not only providing the financial shield through insurance and loans, health loans, but also key is able to prevent people from getting into a hospital through our tech-driven, proactive, personalized and coordinated care. That's the vision, and global in nature. This not only in India but in US also we have launched. So anywhere where health is the priority, we want to see that we are able to establish ourselves as the key player.
I can see there are so many services going on. Can you like list a couple of them?
Sure. So I think for corporates, I will list, right? So corporates, health insurance is our first service, right? And then second service is then the annual health checkups for employees that happens. Now, the key differentiator here is that what happens after the annual health checkup, right? That is where then we again come and we see that we are able to provide, a coordinated care, a data-driven, proactive care to all the employees. Plus, then, many organizations need to have a medical room as per statutory, regulations. And then we are able to provide that medical room equipped with our platform and technology so that they are able to engage, all the employees in a meaningful manner, are able to nudge those employees, and through that, ensure that the wellness journey starts and continues. So three key services: health insurance, which is the financial shield plus health loans. Second are annual health checkups. And third is then, trying to see that we are able to create those smart clinics, not only passive medical rooms, but smart clinics where we have the data, where we have the system, and the nurses or the doctors sitting inside the corporates, they're able to use that technology for a continuous improvement in employees' health. So these are the three big categories.
Otherwise, if it's not for the corporate.
Yeah. So for a general person, let's say like Rahul Verma, is an individual. Of course, again, first comes the financial shield, which is health insurance and health loans. Then the second is that they use our platform as a personal medical record, electronic personal medical record. So like you have your photographs on the cloud, you have your bank details on the cloud, right? But where is your health record? Where is the health record of your parents, right? They're in files and papers, not in one place. So for an individual, then, beyond the financial offerings that we have, we provide a personal medical record platform where all your health records can be at one place, and you are able to longitudinally see the data in terms of how your health is improving, how your family members' health is improving. And then that is the service that we provide. Of course, access to the complete wellness ecosystem, right? Whether that you need a health coach to guide you what you need to do, whether that's a general physician consultation, whether that's any specialist consultation, whether that's any diagnostic test you need, whether that's a dietitian consultation, lifestyle coach. And very importantly, Ritika, we have now even tied up with American doctors to provide second opinion to Indian patients. So we are bringing global standards of healthcare to our patients, making all these things accessible so that people are really able to improve outcomes. You're on mute, Ritika.
Yeah, I had some question. I just
Okay.
missed it. So anyway, I think I'm done with my questions. Is there something that I have missed out on which you would want to let me know?
No, I think I would just like to again emphasize, with the increasing focus corporates have on employee wellness, our solution stands as the only integrated solution where we are looking at, insurance, which is a financial shield, health insurance, plus proactive wellness, right? And because of this, they will be able to see that they're able to really bring an meaningful impact in the improvement of the health and wellness of their employees and the employees' family members. They're able to not only have a financial benefit in terms of reduced health insurance claims, reduced sick leaves, increased productivity, but a much, much more engaged workforce, a workforce which, respects, which acknowledges and recognizes that the corporate actually cares for them in the real sense. So that's the message I want to leave for all the listeners out there, that yes, there are tall claims many companies make, but Nano Health and Assurance by Nano Health, the focus is to see that how we bring all of this together on the same platform in an integrated manner to be able to provide a holistic approach to health and wellness and deliver a measurable ROI.
So, one more thing that I wanted to ask, which I just missed out. So, it is about the data and all. I am using the app and I have a couple of data all stored in the app. So, does your platform analyze the data and give alerts on a couple of things? It does.
Yes. So those are the recommendations. So Ritika, very, very smart question and very relevant. So these are the AI that I mentioned and the medical protocols. So let us say that if your sugar values are above a particular level, then the system will generate recommendations that you need either a lab test, you need a specialist consultation, or you need a diabetes management program. So the system nudges you, and if you are not able to follow, then there is a team, a health coach, which is assigned to you, who will call and try to explain you the various services and the need for those services, and see that you are able to start. You are able to start to take care of your health in a proactive manner, because the platform provides you access to, again, a convenient, trustworthy, and cost-effective services.
That's really great thought, and it's really nice to see everything at a place. Usually there are all different parts where we have to go to, but then this is really nice. We can go one place, we have everything. Yeah. So that's from my end. Thank you so much for sharing your insights and your time. Thanks, Rahul.
Thanks, Ritika.